Frontal massage dynamics considers the sacroiliac joints the #1 lever in the body. All forces go through the sacroiliac joints, and any issues with the sacroiliac joints, any place the sacroiliac joints have restrictions, the body is going to have to operate around those and make adjustments to that. So, in order to get your work to be effective, sacroiliac joints have got to move. So the way the sacroiliac joints are constructed, with the sacrum sitting like so, and then the ilium bones crossing over it about like so, puts the joint on an angle. From a posterior position, the angle of the sacroiliac joint is going down or towards the front of the body and out laterally. So the best way to work it is cross table. I like the base of my palm going right into the sacroiliac joint. You can find it, there's PSIS right there, and just below that and just medial to it will be sacroiliac joint. It's going to be kind of on an angle like that. So with the base of my palm I can push right into it. When I push right into the sacroiliac joint with the base of my palm like that, I'm catching the ilium bone with this part of my palm and the sacrum with this part of my palm, and I'm looking to feel movement between those two. One of the things that makes that easier is to use the leg as to mobilize it. Whenever you bring the lower leg up, release the quad from the table, and come in with my base of my palm on that SI joint, and you can see when I mobilize the leg like so, that movement goes right at the sacroiliac joint. So I could use this mode very easily to put movement into the SI, right into that SI joint. This is one of my basic ways of working the sacroiliac joint. Mobilize the leg, get your body position, I'm leaning against the table, and I'm simply pushing in. Very effective move and very easy to do. Some variations of that are to, depending on how the length of your arm and the length of the client's leg fit, you can get in like that with the right on the hamstring and femur and come right into SI joint. So sometimes you could be working hamstrings, sometimes simply mobilizing the femur, blending the two, and sending that movement into this hip area and using it to be more effective with the sacroiliac joint. You can certainly switch hands and work sacroiliac joint along with the spine. You can come into ASIS area and use that to play off of the sacroiliac joint also. Piriformis. All the deep rotators. I can work them together, and I can work them separately. You'll get, or against each other rather. You'll get a different effect depending on how you do that. Everything will get it in there a little differently. All of them can work. Greater trochanter. Grab greater trochanter, grab the whole thing and let that movement come up into the hip and then right in with the sacroiliac joint. Some other variations from the prone position is bring the leg out and use that movement to go right into the tibia fibula. I could use my leg to do that while I come in and work it back and forth. Searching around for where do I put my hands, where do I pivot the body so that I get the most movement right into the sacroiliac joint. On each person it'll be a little different. And that works pretty good on her. So I would use that position and then work through, around, expand on it. Variations. so. So I'm mobilizing her leg with my leg. I'm supporting it and giving it direction with this hand while this hand is on the table. So body mechanics, or what it takes to do this, is very easy. My arm is supporting me, and so my low back isn't doing the work. Rib cage is up, and that makes this very easy to do. The fibula rotating on the tibia is another component to the SI joint. We consider this lever 1 in the body, and this is 1A, or sub 1. We want to see the fibula rotate, or feel the fibula rotate relative to the tibia. You can find the head of the fibula, put your finger just above it, and another finger in front of it. Push on the fibula with your base of your palm, and you'll feel what kind of movement tibia fibula has right there. You want to feel some nice movement. There's movement there. I would rather see more movement. So if I was doing a massage here, I would spend time working that interosseous space between tibia and fibula. Variety of ways of doing this, all of them, just so you're getting into that interosseous space and you're feeling for what's it feel like in the interosseous space, and what does the distal end of the TibFib joint feel like. You'll be increasing the motion between the two. When a person plants a foot and changes direction, part of that twist that the body does needs to be taken up by the tibia-fibula relationship. If it isn't, and the SI joint is stuck, which it very often will be, in an athlete especially, it's going to leave the ACL very vulnerable. Tearing the anterior cruciate ligament is something that's going to happen a lot easier if the fibula isn't rotating well relative to the tibia. I'm squeezing right into the interosseous space and using movement to get tibia and fibula moving.